Good afternoon. Thanks, Deborah, for the introduction. As you know, I am the president of the National Committee on Children's Environment and Health. It is a scientific independent committee appointed by the Council of Ministers, and it is supported financially only from Minister of Health. Our prime goal is to provide scientific supported advice to the Minister of Health and all the ministers and regulators. We don't have any executive power. We have a mandate to raise awareness and integrate the prevention and precaution into policies and everyday life. And more importantly, we have the task to ensure that we have prompt responses to emerging threats and not fully established but well-documented risks like the EMF we discussed today. And why just a committee is essential? Because experience shows that risk management and legislation in many cases fail to take delayed action to protect appropriate the health of infants and children. And why this is happening? For many reasons: uncertainties or scientific ignorances, controversies, or economic interest. Examples: environmental tobacco smoking, synergistic or cocktail effects of chemicals, biological effects of EMF, RF. There is only one interim option to protect children from potential risk: awareness, precaution, and reduction of the exposure. And we focus primarily on indoor environment where the children are spent most of their time, 60 to 90% depending on their age. And we know that minimization of exposure and risk is mostly dependent on parents and teachers' attitudes. It is less dependent on legislative measure. So the target population for us are parents, doctors, teachers, and children, and of course media. We follow we do a sort of holistic intervention. First of all, we try, whenever possible, to have pilot investigation to collect information and data on Cyprus reality. This can support very much the awareness campaigns, can influence most the policy level, and can raise awareness. And of course, can be used also for media, press, TV, and radio. And on top of this, we have education programs addressing pediatricians, healthcare providers, teachers, and parents. We use many tools. We have our website. We have the videos. You have seen one the first day. We are going to see another one at the end of my talk. We have seminars. We have every month interventions in TV and radio stations. And we issue also a lot of material. Our target is to make the people first to understand, and second to learn how to avoid and minimize exposure. And we have issued a book which is now under revision. This has 15 chapters covering various issues of environmental factors which can impact the children's health. The new chapters are devoted to the use and the risk of these mobile and electronic devices. Examples of some of our campaigns is campaign in relation to various issues of chemicals, including the energy-saving lamp which contains mercury, face painting, baby care, cosmetics, the environmental tobacco smoking, which is a continuous campaign, and now is the mobile phone and wireless technology. But before I go further, I would like just to highlight what it comes also from all our discussions. We are faced a scientific controversy, and probably this would be the case for the next years. So we have the one thought of schools with only thermal consideration, thermal effects. INCRIP and DC limits are based on that. It, by definition, addresses only short-term exposure and happening at very high level of energy at watt per square meter level. And you have the other school of thought, which is related to non-thermal biological effects supported by thousands of peer-reviewed studies. And these are occurring even as low as 1 million times below the existing limits. And this slide shows you what is the situation in terms of the limit of INCRIP on the top And then we have the limits which have been developed since 2007 up to now. And those limits are rather criteria, not limits, criteria based on the no biological effect level. This is the principle. You can see that we go down and down as new emerging research appears. And nowadays, we consider these levels not to be exceeded in order to let us say we have adequate protection of our children. And many people argue that biological effects happens every day, but that not necessarily means that they translated to health impacts. But the answer is opposite. This biological effect can lead to adverse health effect if exposure is chronic, is continuous, like the one we experience now. Why? Some of the argument taken from the bioinitiative report, they interfere with normal body processes, they disrupt homeostasis, prevent the body from healing damaged DNA, produce immune system imbalances, cause metabolic disruption, and many other things. And there, after this, we have essential body processes which can be eventually disabled and lead to pervasive impairment of metabolic, neurological, and reproductive functions, as we found already in many new studies. And why we address this technology? Primarily, the reason is the unique exposure that we experience in 21st century, which is affecting entire population. It is multiple, indeterminate, and it starts and continues through vulnerable stages of the life of a child from embryo to adolescence. And here I put all the argument why we need to address this wire technology today, now. The first two, legislation and exposure, already I referred to them. We have on top the ascertained safety of the technology. Emerging devices without pre-market testing, especially for their long-term effects on children. And then we have people who are not adequately informed about the risk and may have erroneous perception of safety of using this technology. Whilst on the other hand, we have good practices and alternatives to reduce the exposure. And how we are addressing this? Again, we focus on house and school for the reason I explained. We have at policy level interventions and providing advice. We have an open dialogue still, ongoing dialogue to avoid Wi-Fi in the School of Cyprus with the Ministry of Education, Ministry of Health. We are happy to say that we cooperate very closely with parliamentary committees and with the Environment Commissioner in person in this. It supports very much our efforts. And on parallel, we try to train and educate the pediatricians because they are very close to the families. They can influence the families. We also focus on children and teachers. And we focus very much on parents. These are the most difficult audience in our efforts, and I explain you in a minute. What we have achieved 1 year ago is to have one campaign, awareness raised to reduce exposure and protect children from EMF. This campaign was launched by the Minister of Health in a press conference, and we are happy to have here Minister of Education and Minister of Environment and the Minister of Communication, Education, and the Environment Commissioner. And what was the outcome of this event is that everybody accept the need to protect the children, but we got strong support and committed for precautionary action by the Minister of Health, which is always supporting our efforts. Key suggestions that we provide from our committee to the Minister of Health, because we believe that we have to act now, is we said that we acknowledge that changing the basic legislation is very difficult and will take time. So we proposed in the meantime, based on the precautionary principle, that biological relevant criteria like the ones I have shown, be applied complementary to the existing limits, at least for the evaluation of children exposure. To promote supplementary regulation based on the model of France legislation so that we prohibit Wi-Fi and mobile phones in kindergartens, elementary school at least, and put restrictions to secondary school. And to raise, to strengthen their awareness campaign, and via school medical services, students should be monitored for any electromagnetic hypersensitivity symptoms. And a snapshot of suggestions in memo, an extended memo, I would say, we sent to the Minister of Education on the issue of Wi-Fi. First of all, we questioned very much the necessity of the Wi-Fi, and that should be avoided. Wi-Fi should be applied only when there is no other solution and under restrictions and prerequisites. We, the Ministry of Education was at the point to go to the process for tenders to Wi-Fi all the School of Cyprus. So we ask Minister, please do a pilot implementation first, evaluate this, and based on the results, then you can make your decision. And how this pilot should be work started from the highest class with a restricted application, not a full coverage in the school, educated students and teachers on the risk. This should be followed by evaluation of exposure under realistic conditions and based on biological reference criteria in addition to the legal limit, because we know that they do not cover the effects on children. Monitoring of any symptoms of a high electrosensitivity. We still are waiting for the answer on this memo, but we are happy to say that till now the process didn't start, at least. Awareness reigns for the parents. This is a very difficult task because most of them, they have wrong perception. And our aim is to remove this, to correct this perception. And I will show you how we did it, few examples. We mythos is a Greek word, but I think everybody understands what it means. It means something which is not real, and erroneous perception versus emerging evidence. Mythos number 1, when devices are working with limits of equilibrium, are safe. This is what everybody believes. And we said that these limits are not adequate, and I don't go further because I already expressed what is happening. Effects of DNA. Only the ionizing radiation can affect the DNA. The reality is that we know today from a lot of literature and research that EMF can destroy via oxidative mechanism, and not only, it can also affect DNA repairing mechanism like melatonin. So it's another illusion about the safety. And about Wi-Fis, because the energy emitted is relatively low, they are safe. This is what people believe. And we said this is true, but Wi-Fi have pulses and peak of very high intensity because they transfer information. Exposure duration can be very long, for some hours up to 24 hours. The user connected to a Wi-Fi can receive radiation similar as if he is at the distance of 50 to 150 meters from a mast. The people are afraid. They don't want the mast, but they have the mast in their home. Wi-Fi can also cause passive exposure to any bystander and other non-users. And Wi-Fi in school, I like this picture taken from Wi-Fi in school in Australia. It shows how it looks in a classroom with 30 computers and routers and whatever. So each student is exposed to its own, let us say, exposure from his own computer, but it has also a passive exposure from all computers which are around him. This is the reality in the classroom, and this has never been tested. And there are a lot of organizations claiming against Wi-Fi. I just want to show what the Austrian Medical Chamber says. Wi-Fis can lead to high microwave exposure of children, which might increase the burden of oxidative stress, which then slow down the energy production, especially in brain cells, and may lead to concentration difficulties and memory problems in certain individuals. The Austrian Medical Association recommends Wi-Fi-free environment. And this is the legislation coming from France. It's a landmark legislation, I would say. And another myth is related to the wireless baby monitors. This, they think, is safe, is no problem. The reality is, again, that you have a lot of radiation on the head of the child, very close to its head. So there are alternatives. There are wired or analog type, but always at a distance of 2 meters. Basic keys to reduce exposure: keep a distance from the source, use hands-free, reduction of the exposure duration and frequency. The usage must be inverted proportional to the age of the child. Opt for wireless, not wireless. Look for schools which are Wi-Fi free. Deactivated all Wi-Fi, Bluetooth, 3G, 4G when not in use, when pregnant or child are nearby, and always in the night. And finally, children with existing neurological problems that include cognitive, learning, attention, memory, or behavioral problems, as well as with chronic diseases like cancer, must be provided with wired learning environment. Schools and playgrounds should not have this symbol of free Wi-Fi. Rather, we should look for schools and places where we see this symbol. We love children, we are free from Wi-Fi. And some final closing remarks I would like to share with you. I think, and I believe after also this conference, I am convinced that we know enough to apply precaution and to ensure our children's future. We must push for safer regulation adjusted to children's specificities. In the interim, biological relevant criteria should be applied. Instead of requiring from the society the absolute proof of damage, we should demand proof of safety from the industry itself. Thank you very much. Our website, which is also shown on our slides. Of course, you don't have many things in English yet.
Σύμφωνα με τον Παγκόσμιο Οργανισμό Υγείας, η ακτινοβολία που εκπέμπεται από τα κινητά τηλέφωνα, τα Wi-Fi και άλλες ασύρματες συσκευές είναι πιθανώς καρκινογόνα για τον άνθρωπο. Ο πιθανός αυτός κίνδυνος είναι ακόμα μεγαλύτερος για το έμβριο, αφού αυτό αναπτύσσεται καθημερινά και είναι ιδιαίτερα ευάλωτο.
Μία νέα ζωή μεγαλώνει μέσα μου και έχω ευθύνη να την προστατέψω. Έχω ευθύνη να διασφαλίσω ότι το παιδί μου θα αναπτυχθεί σωστά και θα γεννηθεί υγιές. Λαμβάνω σοβαρά υπόψη τις συστάσεις των ειδικών και με απλά και αποτελεσματικά μέτρα προστατεύω το παιδί μου από τους πιθανούς κινδύνους. Περιορίζω σημαντικά την χρήση του κινητού τηλεφώνου και έχω απενεργοποιημένες τις προσβάσεις στο διαδίκτυο. Όταν χρειαστεί να το χρησιμοποιήσω, το τοποθετώ πάντα μακριά από την κοιλιά μου. Χρησιμοποιώ ενσύρματη σύνδεση στον υπολογιστή μου για να έχω ασφαλή πρόσβαση στο διαδίκτυο. Αποφεύγω την παθητική έκθεση κρατώντας αποστάσεις από αυτούς που χρησιμοποιούν κινητό τηλέφωνο ή άλλες ασύρματες συσκευές. Στο σπίτι ενεργοποιώ τις ασύρματες συνδέσεις μόνο όταν είναι ανάγκη και τις κρατώ πάντα κλειστές κατά τη διάρκεια της νύχτας.
Η ζωή και το μέλλον του είναι στα δικά σου χέρια. Έχεις ευθύνη και μπορείς να το προστατεύσεις. Τα παιδιά μας εκτίθενται καθημερινά σε ένα ηλεκτρονικό νέφος, το οποίο δημιουργείται από την ακτινοβολία που εκπέμπουν τα κινητά τηλέφωνα, tablets και οι συνδέσεις μέσω Wi-Fi και άλλα παρόμοια. Η ακτινοβολία αυτή, σύμφωνα με τον Παγκόσμιο Οργανισμό Υγείας, είναι πιθανώς καρκινογόνα για τον άνθρωπο. Σύμφωνα με νεότερες έρευνες, η ακτινοβολία αυτή είναι πιθανό να προκαλέσει και άλλες σοβαρές επιδράσεις στην ανάπτυξη και λειτουργία του εγκεφάλου, του αναπαραγωγικού και άλλων συστημάτων του εμβρίου και του παιδιού, να προκαλέσει καταστροφή των νευρικών κυττάρων και του DNA, διάσπαση της προσοχής, διαταραχές στη μάθηση και άλλες νευρολογικές παθήσεις. Τα παιδιά είναι πολύ ευάλωτα. Μπορούμε όμως σε σημαντικό βαθμό να τα προφυλάξουμε από ένα σοβαρό κίνδυνο. Φτάνει να μάθουμε πώς.
Αφού μας αγαπάτε, γιατί μας ακτινοβολείτε με τα Wi-Fi και τα κινητά σας τηλέφωνα? Έχουμε δικαίωμα στην υγεία και πρώτοι εσείς μπορείτε και πρέπει να μας προφυλάξετε.
Στη βάση της αρχής της προφύλαξης, το Συμβούλιο της Ευρώπης, το Ευρωκοινοβούλιο, επιστήμονες, ιατρικοί και εκπαιδευτικοί σύλλογοι στην Ευρώπη συμβουλεύουν ότι θα πρέπει να μειωθεί η έκθεση των παιδιών στην ακτινοβολία που εκπέμπουν τα κινητά τηλέφωνα, tablets και οι συνδέσεις μέσω Wi-Fi, ιδίως στο σπίτι και στο σχολείο.
Η έκθεση των παιδιών σε ηλεκτρονικό νέφος εγκυμονεί κινδύνους. Η χρήση των κινητών και συσκευών Wi-Fi από παιδιά μικρότερα των 14 ετών πρέπει να αποφεύγεται. Προφυλάξτε την υγεία και το μέλλον των παιδιών σας. Το ίδιο ισχύει και για την έγκυο. Οι έφηβοι ποτέ δεν βάζουν το κινητό στο υπνοδωμάτιο τους, στις τσέπες τους, στα μπράτσα ή κοντά στο στήθος τους. Πάντα χρησιμοποιούν hands-free και κρατούν το κινητό μακριά από το σώμα τους.
Αξιοποιώ την τεχνολογία σωστά. Γνωρίζω τους κινδύνους και δεν εξαρτώμαι από αυτή. Χρησιμοποιώ ενσύρματη σύνδεση για τον υπολογιστή του σπιτιού μου και ενεργοποιώ το Wi-Fi και τα δεδομένα κινητής τηλεφωνίας μόνο όταν χρειάζεται και ποτέ όταν τα παιδιά μου είναι κοντά. Δεν χρησιμοποιώ κινητό τηλέφωνο στο αυτοκίνητο όταν τα παιδιά μου βρίσκονται σε αυτό. Η έκθεση στην ακτινοβολία είναι πολύ μεγαλύτερη. Προστατεύω πάντα τα παιδιά μου.
Η Γαλλία ήδη με νόμο απαγόρευσε τη χρήση Wi-Fi σε παιδικούς σταθμούς και σε χώρους όπου φιλοξενούνται παιδιά κάτω των 3 χρόνων. Επιτρέπει ελάχιστη χρήση στα σχολεία κάτω από αυστηρούς περιορισμούς.
Στον υπηαγωγείο, στο σχολείο και στο σπίτι περνάμε τουλάχιστον το 75% του χρόνου μας.
Απαιτούμε ασφάλεια χωρίς ακτινοβολίες από Wi-Fi, κινητά και άλλες ασύρματες συνδέσεις. Η υγεία είναι δικαίωμα. Δεν μας το στερείτε.
Δεν έχουμε το δικαίωμα να ρισκάρουμε την υγεία των παιδιών μας αναμένοντας παθητικά τους άλλους να κάνουν κάτι. Ας ξεχάσουμε τι είναι βολικό για μας και ας τους χαρίσουμε το καλύτερο δώρο, την υγεία τους, μετατρέποντας το σπίτι και το σχολείο σε όαση προστασίας.
Το σπίτι μου είναι όαση αγάπης και ασφάλειας. Σβήνω τα Wi-Fi και άλλες ασύρματες συνδέσεις όταν δεν χρησιμοποιούνται και κυρίως όταν τα παιδιά είναι στο σπίτι και τα κλείνω πάντοτε το βράδυ. Αξιοποιώ το κουμπάκι on-off. Είναι τόσο απλό να μειώσω το χρόνο αχρίαστης έκθεσης. Επενδύω στην υγεία των παιδιών μου μακροχρόνια.
Η ζωή και το μέλλον τους είναι στα δικά μας χέρια. Δώστε στα παιδιά ένα μοναδικό δώρο ζωής, την υγεία τους.
Thank you very much for this very instructive lecture. My name is Elliot Berry. I'm from the Hebrew University, and I'm involved with also trying to change behavior. And yours is a model, whether it's to give up smoking, whether it's nutrition and lifestyle and prevention of junk food and obesity. This is the model to do it. So what I would like to say is that there are a couple of things that I think we could add to your excellent ideas. One is to change behavior in children. It's as good as their teachers and the television, but you need the peer group and you need role models. They're very influenced what the other children are doing. Mm-hmm. How to harness them, that's another matter. But the horse is already bolted from the stable. Everybody's using Wi-Fi and everybody's using mobile phones. So this information is excellent. The other missing link, and this is what we know from the junk food, you have to bring the food industry, or in this case the wireless technology industry, all the big manufacturers have to be part of the consortium to do it with your guidance. Mm-hmm. And if you don't have industry on board, and I don't think you're going to we were able to achieve the result.
Okay, thank you very much for your comments. Are very relevant and very useful. I just have to say that in Cyprus we don't have industries at all. So for us it's, let us say, more easier because we are not fighting big economic interest, although I mean, we have only providers and we have only people that import the devices. So if a decision is taken by the government to reduce wireless Wi-Fi and put the other, then they have to import those devices. So it's not that a problem because we don't have industry. We are lucky that we don't have industry. But I would agree with you, and I would agree also for the children because we have the experience when we made our environmental tobacco smoking. We actually used the children as a pressure group to influence their parents. But now in that case, it will be more difficult to let us say, to use the children because the children have a lot of fun with all these devices. And so we have to be very, very careful to make them to understand, to make them a little bit feel that might be a problem. It's a little bit more tricky now.
All right, I want to show you something, Elliot, that's relevant to exactly what you've asked. Environmental Health Trust holds an annual contest in Jackson Hole, Wyoming, and we're spreading to other places where we go into the schools, and this year Serena Scott is going to be directing that contest. We work with the teachers first, and then the parents, and the children, when they go home for Pesach or their spring break, they get a contest that they come back, and within the week after they come back from school, they can have a 60-second video, a poster, a poem, and this was our prize-winning song we're going to show you because it was done by kids for kids, and we ran it in the local movie theaters. We calculate it's been seen by more than 50,000 people because Jackson Hole gets tourists, and we've shown it at the peak time for tourists in the movie theaters. So we'll show you a beginning of it here.
Here, let's have a little chat. Well, I'm not here to tell you that technology's bad. There's just a few things that you ought to keep in mind to keep yourself healthy, body, spirit, mind. I will always turn my phone off before I leave that parking lot, and I'll keep my phone off my body. And I'll never post anything that my Grammy wouldn't wanna see. That's how I practice safe technology. Yeah. Well, you might have guessed it, there are more than these three things. So I'll repeat the chorus and I'll tell you three more things. I'll always turn my phone off when my signal's getting low, and I'll never sleep within my sheets. And I'll always use a headphone when people call and talk to me. That's how I'll practice safe technology. If you wanna reach me, you can call my landline. If you wanna call me, just call my home phone. Leave me a message after the tone, and I will call you as soon as I'm home. Leave me a message after the beep, so I can stay radiation free.
It's beautiful.
And they did this themselves, and we really, and we have on our website a toolkit so that other schools can have a contest. Practice safe technology contest. We will be delighted to work with the School of Public Health to promote this as well in the schools here in Israel. And we find that you have to first go into a school where there is some concern. You work with the parents and the teachers together, and you say, look,
We don't want your kids, and first of all, the driving and accidents with using a cell phone and texting and cell phone, it's really been a serious problem. Absolutely. And then I heard today about Pokemon Go. You know about this?
Yeah,
yes,
this
with
is
kids getting killed because they're, right. So promoting safe technology, this is done by teenagers for teenagers. It's
fantastic.
Rather popular. We will share it obviously with anyone who would like to use it. Just I think in Jackson we've had an impact because now when I talk to the kids who are coming up through the school systems and they've been hearing this now, it's our 6th year, and at this point there's a pretty broad awareness, and many of the physicians in the community are also part of this to give out information in their clinics. So all of the information, which by the way, I don't know if you got a chance to pick it up, but we have it out there at the registration desk. The safety cards, the pamphlets, and all of that are ways to try to reach them. And we would welcome, for example, doing with some students a pre and post evaluation. Because we actually, in our beginning, we had questionnaires of what did people do, how do you keep your phone, where do you use it, etc. And we were able to show behavioral change. So this would be a very, very welcome thing we would love to add with you because we